Edge Benefits podcast with our host, Tom Quigley of ClaimLinx. Tom, how are you? Here we go. This week's podcast, which we're recording again, has had some really good feedback when you've talked about what's happening with healthcare. And it was very surprising in a lot of ways to show you what could happen to the healthcare system if things are changed and they cut things. Right?
Oh, devastating to a lot of people.
Definitely devastating and sad in so many ways. Politicians make big promises about healthcare. From your perspective, which of these promises typically affects small businesses the most?
The biggest one is the Affordable Care Act. It's all about learning, right? It's about learning about the laws. And the problem is the insurance industry is so complex in terms of there's so many people with their hands in the cookie jar, from the pharmacies to the insurance carriers to the agents to everyone, the hospitals. They're all bought up, all these politicians, in terms of campaign funding and all that. So if they want to solve the problem in America for health insurance, here's how you do it. Since the government's already involved, all they do is they put a $50,000 deductible on every American. The Americans have a choice. They can take advantage of subsidies still. They can take advantage of buying insurance, or they could self-fund it. You also throw in that bill, you take away the ability to find bankruptcy. So what you're doing there is basically every American knows that the worst case that they could have is $50,000 out of pocket. They can buy insurance to take it away. And now you just solve the issue right there overnight. It's that simple. It's not hard, because then you have all these people, all the companies buying for business, and literally people could take advantage of all of this. And most people aren't doing it. It's just a total, no one understands it. See, no one understands health insurance at all. So the way you solve it is you say, okay, guys, here, good luck. And you can still use the same tax laws, Section 105. So the first $50,000 can be tax-free dollars still. So you can have companies will cut their health insurance rates by 80%. The government wins because they've created taxable income that is now it's been tax-free. These $3,000 a month premiums on group health for families, that whole $36,000 is tax-free dollars. So the government's not getting anything.
No.
You're missing the boat. It's that simple. It's not hard.
No, it's not hard at all, Tom. And the process is that you run into is you can make changes. And is this something that needs to be lobbied in a way, Tom, or you're the solution? So you don't need to lobby anything.
You lobby it, but you have think about it. You cut the agents' commissions by 80%. They're not happy. You cut the pharmaceutical big time, because now they have to go abide by what they have to with Medicare on everyone. You irritate the hospitals, probably the ones that want the biggest, because they know that, hey, any major claim, the majority is going to be paid. Then what you do, if you have private doctors who you pay a monthly fee for, which they already have, by the way, or you have hospitals, you pay a monthly fee to use their hospital services and doctors, and there you go. And they don't have to opt in to the other game. But see, the problem is, that's logic. The problem you have is politics and logic don't mix these days. There's no logic. And then if you want to do it the right way, you take advantage of all the tax laws. Exactly what we do that. There's no reason to be paying all this outrageous health insurance premiums. It's a game. But the problem is all the government restrictions and the other thing they should have is if you want to have an ACA plan, great. But if you want to buy a plan how you used to be able to and you're healthy, do it. So what they do is they have these plans that, you have a choice. If you're not that healthy, you do the ACA. But the problem is the insurance companies scream because they call it the bad health risks, kill the rates, blah, 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 blah. Truth of the matter is the insurance carriers buy reinsurance themselves. They already have the system I said the government should have in place themselves. All insurance companies, they give you a network, they give you catastrophic coverage, but they don't tell you the catastrophic coverage they outsource to like Lloyd's of London, AIG, Gerber, Baby Food on reinsurance. So if you and I wanted to start an insurance company, we could literally have a $25,000 risk. You buy reinsurance after that. And we get investors, and where we rent a network such as Signal, we hire a TPA to manage. And now you have an insurance plan. It's not hard.
That's something Robert Kiyosaki talked about, right? Of doing that for tax purposes.
The problem is the bigger people doing these level funded plans have the volume to buy the reinsurance for much cheaper dollars than what you and I do.
I got it.
It's all about numbers. All numbers.
Can you break down how federal versus state level healthcare policies trickle down to small employers?
Sure. So let's say down in New Hampshire right now. So we'll use Massachusetts, New Hampshire. So Maine, Massachusetts allow level funded health plans for groups that are much cheaper than what you can buy traditional insurance, such as Blue Crosses of the world and United of the world. So New Hampshire, Massachusetts, and Maine, you get 2, 3, 4 people, and they can buy it. In New Hampshire, they don't allow anyone to buy until you have at least 50 employees. So what they've done is, in the state of New Hampshire, is they've hurt all small business owners. Because the second part of it is, if they're smart, they make their plans unaffordable and allow their employees to get subsidies. But the plans in New Hampshire don't have the Boston hospitals like the plans that we do. And everyone cries because they want the Boston hospitals, the children's hospitals, most things. Whereas in New Hampshire doesn't have those plans unless you buy small group that are outrageously priced, and they don't allow the competitive prices. So New York's even worse. They're 100 people. So you have these states that have their silly rules, and they're driving the cost of health insurance up for the small business owners to the point where they can't afford it. And they all have political, they don't know what they're doing.
No, they don't at all, dude. It's ridiculous. Are there any health
insurance of New Hampshire? They're a joke. They literally are out trying to cause problems for companies by the way they are running their industry. And they all get premium tax. Would you rather have premium tax at $100 million or $80?
All right. So what's the biggest myth about political promises around healthcare that small businesses need to stop believing?
They're going to fix the system with this beautiful law or the system that they have now. A small business, almost everyone I meet, can divide by 2 and improve benefits for employees. What I mean by divide by 2, if you're paying $100,000, you can knock it to 50. You got to change. You got to take advantage of tax laws. I don't like using loopholes. It just makes it sound like you're doing something shady. But it's tax breaks. Every law has tax breaks. And like the Inflation Reduction Act, I did the solar equipment. I don't pay any taxes. It's not a loophole. It's part of the bill. It's a break, tax break. The Affordable Care Act has those breaks also. But the problem is the small business owners setting themselves up for failure because they're listening to commission-based insurance agents who are only getting paid the way they did it 30 years ago.
How do I want to go with this one that's really interesting. Are there any healthcare reforms being proposed this election cycle that small business owners should take seriously? We already talked about it, right?
The expansion of the tax credits that are sunset at the end of 2025, they need to change it. It's my understanding that the Democrats are going to refuse to balance the budget or whatever the budget. Fund the budget, I guess, is the better way. Haven't balanced the budget once. So they're not going to pass anything unless they include expansion of subsidies, which the Republicans should be doing also. I don't know who advises these folks, but they really don't get it. They should be encouraging small companies to take advantage of let their employees take advantage of the subsidies because like I mentioned before, you create taxable income now that offsets the subsidies. They don't understand what they pass. That's the problem. They pass these laws and they don't understand it. I mean, the Affordable Care Act's pride that Nancy Pelosi's sitting there going, we got to pass this law to rate it. Now, anybody in any business would have been fired on the spot for that comment. Instead, they pick their Speaker of the House. Wow. That's what you're dealing with. You're dealing with nut jobs.
Exactly, because they aren't able to run anything, and that they have a role that's running the country. What role does ClaimLinx play in helping businesses navigate the uncertainty of shifting healthcare policies?
We're on top of them. Like I said, every law has tax breaks. Do you want to take advantage of them? We have a lawyer, tax attorneys, accountants who are all over it. Not only health insurance, like I mentioned, the solar. There's all kinds of ways. Every law has tax breaks. Understand the tax breaks.
That's why
don't be all upset about, I got to pay all these new taxes or whatever it is. Understand the tax break, the Affordable Care Act. My advice to every small business owner, understand the tax breaks. If you do, you gravitate to me. If you don't, you keep doing what you're doing and you're hurting your employees. I hate to tell you everyone that, but that's what they're doing.
So the best place people can go is ClaimLinx.com and schedule a call with Tom and his team today. Appreciate it, Tom.
Thank you.
All right, that was the special simulcast of the Neil Haley Show and the Cutting Edge Benefits Podcast.